At the time of diagnosis, a woman with breast cancer will come to the office and to make that critical decision as how to move forward with their adjuvant therapy. There are a lot of parameters that we will use to ascertain risk and determine what the best treatment might be. First and foremost is the clinical presentation and the stage of the cancer. Second, come a variety of these biomarkers that we now use to help differentiate who needs chemotherapy, who needs hormone therapy, who needs combinations of those therapies, and predictions in terms of outcome, of treatment, and the benefit of those same therapies. But more importantly now, as we enter the era of personalized and individualized medicine, looking at the genomic analysis of that tumor, first to make a decision of what needs to happen in the first 5 years. Do they need chemotherapy in addition to their hormone therapy? And this is, of course, specifically for those women who are hormone positive. And then secondly, what to do when those patients now have survived their first 5 years and how to move forward. We now have genomic analyses for both of those scenarios. The most critical and new development is what to do at that 5th year when we have been relatively stuck with information that tells us that a small percentage of women will benefit from an additional time on anti-estrogen therapy beyond the 5th year, but we're trying to fine-tune that and individualize that to determine who actually is going to do that.
This field has changed enormously over the past 20 years. I mean, we would not think of treating a patient without that information back. And that being said, I find it hard to treat a patient now without the genomic information from when the patient is post-operatively and we're discussing the benefit of chemotherapy or the potential benefit of chemotherapy. We now have assays to help guide us with that information. Up to just recently, we now have several clinical trials giving us the information and leading to the result that 10 years of endocrine treatment is better than 5 years and offers some benefit. That benefit for the overall population of women with breast cancer is relatively small, single digits. But with BCI, we now have an assay to give us more information, to personalize the treatment for individual patients. And again, I think it's one of these paradigm shifts that we've had so many of over the past few decades. But here is another one, and it really is of great benefit to patients.